I'm presenting a primer on adult diabetes, adult onset diabetes, also known as type 2 diabetes. Diabetes can be defined as a situation when the body cannot properly utilize the insulin that is released or does not make enough insulin. As a result, there is a buildup of sugar known as glucose up in the blood. So instead of being used as energy, about 90% of people with diabetes worldwide have type 2 diabetes. Type 2 diabetes more often develops in adults, but children can also be affected. And that takes us to the issue of who should be screened for diabetes mellitus. People age 40 and over should be screened every 3 years. First degree relative of diabetes sufferers, like son, daughter, brother, sister, father, mother, also should be screened every 3 years. And members of high-risk populations, such as the Aboriginal, the Africans, the Asian, Hispanic, or people of South Asian descent. People with history of pre-diabetes, people with history of gestational diabetes, people with history of women who have delivered big infants, patients who suffer from hypertension and obesity, as well as abdominal obesity, and patients who have suffered with polycystic ovary disease. All of these people should be screened for diabetes mellitus. Some of the symptoms and signs of diabetes include unusual thirst, frequent urination, weight changes, extreme fatigue or lack of energy, blurry vision, frequent or recurring infections, cuts and bruises that are slow to heal, tingling or numbness in the hands or feet, trouble getting or maintaining an erection, obviously for men. There is also a situation we call pre-diabetes, and I did mention earlier on this as people we should also be screened a bit more frequently. Pre-diabetes is a situation where there is elevated blood sugar levels, but it does not quite meet the criteria for diabetes. It is estimated that more than 5 to 7 million people, Canadians, suffer from pre-diabetes, and these are the people who are most prone to going on to develop the full-blown disease. Pre-diabetes refers to blood glucose levels that are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. That is, we're talking about fasting plasma glucose of 7 millimoles per liter or higher. Nearly 50% of those with pre-diabetes will go on to develop type 2 diabetes. Some of the complications of diabetes include anxiety. Anxiety disorders can be increased in individuals with diabetes compared with the general population and potentially impacts blood sugar control. Depression is also quite common in patients with diabetes. It is more common in people with diabetes compared to the general population. Then there are what we call the macrovascular changes. These are, when we talk about macrovascular changes, we're talking about diseases such as stroke and cardiovascular diseases. Now, cardiovascular diseases are more likely to afflict people with diabetes than people in the general population. In fact, cardiovascular diseases are the most common cause of death for people with both type 1 and type 2 diabetes. Cardiovascular diseases such as heart attack is generally caused by a process called atherosclerosis, which is the narrowing of arteries, and this can lead to a heart attack. Similarly, strokes are like heart attacks, but they happen in the brain. They occur when blood can no longer feed the brain. Either an obstruction like a blood clot or a break in blood vessel that leads to the that goes to the brain can stop the blood flow. Strokes, just as well as heart attacks, can cause severe disability, heart damage, and brain damage, respectively. And then there is also what we call the microvascular complications. Microvascular obviously means the small vessel diseases. And this will include diabetic retinopathy, which is a leading cause of blindness in Canada. It is estimated that about 1 to 2,500 new cases of diabetic retinopathy is diagnosed every year. This is a result of leakage from or abnormal growth of blood vessels that supply the retina, the light sensitive and vision essential region of the back of the eye. Neuropathy is another microvascular disease. It affects the body's nerves and often manifests as leg and foot problems. Usually people will complain of tingling and burning. Common symptoms of neuropathy include tingling, numbness, and pain, which can become very excruciating. But some people experience no symptoms at all. A lack of sensation can lead to untended wounds, which is especially problematic because wound deterioration and infection can sometimes lead to amputation. And then there is the third microvascular change is nephropathy. Nephropathy just means kidney disease, and this develops when nephrons, the cluster of blood vessels in the kidney that filter out waste from the body, lose their filtering capacity. To assess kidney, doctors check the urine for a protein we call albumin, which is normally retained in the body but can leak out of the nephrons when they are damaged. Microalbuminuria, the diagnosis for small leakage levels, can progress to proteinuria and finally to overt diabetic nephropathy. In severe cases, the kidneys can fail, leading to the need for dialysis or a kidney transplant. Some other complications of diabetes include hypertension and also men's health issues. Essentially, we're talking about erectile dysfunction. Some of the key elements in the treatment of diabetes includes education. Education is key. Diabetes education is an important first step for both people with already diagnosed with diabetes, pre-diabetes, or people in the general population who are prone. All people with diabetes need to be informed about their condition. I always encourage my patients to read as widely as possible. A primary source of information that I direct my patients in this category to read will be to visit diabetes.ca. It's a mine of information for both living and managing diabetes. Physical activity is very important, and when we talk about physical activity, we're talking about aerobic type exercises, not about weightlifting or trying to build up muscles. Regular physical activity, especially of the aerobic type, helps your body to lower blood glucose levels. It promotes weight loss, reduces stress, and enhances overall fitness. Nutrition, of course, is primary. Diabetes is a disease where sugar levels are very, very high. What, when, and how much you eat all play an important role in regulating blood glucose levels. What it simply means is you want to avoid as much as possible the intake of refined sugars, cake, soft drinks, juices, which are heavily laden with glucose. I want to go with the more natural types of starch rather than the refined one. Nutrition, weight management is also important. We know that when people have excess body fat, it prevents the efficient use of the insulin that is made by the body. Maintaining a healthy weight is especially important in the management of type 2 diabetes. Medication becomes key, especially when we've given a bit of time, 3 to 6 months, usually for people with blood sugar levels that are high, but with hemoglobin A1C less than 8.5. We tend to want to give this group of people room to use exercise and their diet to manage their diabetes. But for people with A1C greater than 8.5%, or people with who have already done a trial without medication and are not getting a control of their blood sugar, medication becomes important. With type 1 diabetes, which is outside the scope of this discussion, insulin obviously is the choice. However, for type 2 diabetic patients, meal planning as well as medication, and we have a whole variety of medication that's going to be outside the scope of this discussion. And we also do use insulin to assist body in controlling blood glucose more effectively. It is good to have a sit down with your doctor, and he'll help you decide. He or she will help you decide which medication or medications will be most useful. Just remember, 2 out of every 3 patients who suffering from diabetes will need more than 1 medication. So 1 medication may not do it. Sometimes we need 2, even 3 medications. Learning to manage lifestyle is also very important. We need to learn to reduce our stresses in day-to-day life, and it does help somewhat in managing diabetes. Now, people with diabetes also tend to have high blood pressure, and this can lead to eye disease, heart disease, stroke, and kidney diseases. So people with diabetes should try to maintain a blood pressure level at or below 130/80 millimeters of mercury pressure. To do this, you may need to change your eating and physical habits and or take medication. I've presented on this particular slide a diabetes portion plate. If you notice, non-starch vegetables should be about 50% of our plate. The starchy food from where we derive strength should be about 25% or 1/4 of the plate. Now, I understand this is probably where many of us err. We eat more of the starchy foods than we should. And then protein should be another 25% or 1/4 of your plate. And then we also recommend adding 8 ounces glass of non-fat or low-fat milk, usually 1 to 2%. And adding a piece of fruit or half a cup of fruit salad to our meals is also encouraged. One thing we're trying to avoid here are the refined sugars. You need to minimize, if you must at all, the eating or the consumption of refined sugars. I've put in here a video on diabetes, trying to explain precisely what I've been emphasizing, but we will not be going over that. What next? If you love the presentation, please pass it on. Remember, diabetes can be controlled. It is not a death sentence. I thank you for listening.